We have such a broad remit because we cover an ageless service from children and adolescents through adults and into older age, that we had to split the work into very small work streams and ask each of the areas, including prisons as a separate group, to feed back to us as a group. They came and presented what was going well in their area, what the challenges were and what their ideas were for developing services, improving services for patients for the future. So we also met with users and carers for the same reason, to get their perspective and try to add that together so that the group had a very broad understanding of all the challenges before we moved to the next stage. From the staff, the messages were often about increasing demand on services, and that was across all age ranges. Particularly, I think, though, the predicted increase in demand with the older people, and particularly with the area of dementia, and the need to really bolster services in the community to help people stay at home. The broad theme was about trying to keep people at home where possible, so that involved things like early intervention, self-management, but particularly early intervention in psychosis in the adult population, and developing better crisis services for adolescents and for adults, as these are areas where we would generate admissions otherwise if we don't do this better, and it allows people to stay at home with their families. I think there are concerns across the country, it's not specific to NHS Forth Valley, that the availability of doctors, for example, both in general practice and the acute hospital, including psychiatry, is an issue. That has its challenges but affords opportunities as well, as it allows us to look at our workforce and be more inventive in terms of developing enhanced roles for other members of staff, such as nursing and AHPs, such as OTs and speech and language therapy, etc. So there are opportunities, and we have to take them. The other thing we've got, obviously we are fortunate in mental health that we do a lot of our work in the community, and with health and social care integration we have the opportunity of avoiding duplication of work by two agencies and coming together and to actually deliver a more joined up, seamless service for people, which is more holistic, and we have good experience already to build on. I think the 5-year plan is very challenging because of the financial climate we're in, but I think it's certainly something we are up for the challenge in mental health. I think the most important thing for us is that we do try to reduce our waiting times and make the pathways smoother for patients. We will have to make some difficult decisions about what our priorities are, and that's partly what this plan outlines, the areas where we have to put most of our efforts.